Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum everyone. Hope you're all doing fine, inshallah. I'm Mohib, year one student. And today, me and my colleague Aicha, inshallah, will be explaining you the blood chapter for your first quiz, midterm, final. It will be all along with you guys. Before we start, I would like to congratulate every single one of you on passing the Biology 1 course. Taking Biology 2 is a huge step. And inshallah, all of you will be passing Foundation, inshallah. We've got snacks for those who participate, so make sure to participate, answer the questions. This will help you retain information. You will get also snacks, and win-win situations. Bismillah. This is our roadmap, what we'll be taking. These are the sections of the chapter. 17.1 is about the functions of blood. 17.2 to 17.8, I'll be explaining the first three alongside with half of 17.4. And from 17.4 to 17.8, Aicha will be taking. And I'll also be coming back at the end to explain the blood notes, alright? Which is the file that Dr. Abubakar and Dr. sent you on Blackboard about jaundice and stuff. Bismillah. 17.1, the functions of blood. What are the functions of blood? Who can tell me the functions of blood? Come on, guys.
Regulation.
There's not. Yes, give me. Transport. If you studied the chapter, you already know the answers from the book, it's okay. Answer. Give me. Yes.
Regulation.
Regulation, one more.
Protection.
Who else? Yeah.
Protection.
No snacks for me. بس صح. And you will get.
ظلم الله ما بيحب.
يحيى الشدام.
الله ما بيحب.
All of the answers were correct. First one we've got transport, that's correct. Second we've got regulation and protection. It's not enough to know these functions alone, so that's why we'll be explaining what does blood transport, what does blood regulate, what does blood what else?
Protection.
Protect, yeah. So what does blood transport? Answer my questions. طبعا ما هعطي للكل يا شباب، كل ما حد يجاوب يخلصوا عليه لأنه في أسئلة. ثاني اللي يجاوب حيكون حلو، أعطيني خالد.
Oxygen and nutrients.
Oxygen and nutrients, that's an example. What else?
Hormones.
Yes, then
Carbon dioxide.
carbon dioxide. Any answer, guys? عادي, even if it's wrong.
Hormones.
Hormones, exactly. طيب, what does blood transport? First of all, we've got oxygen, which comes from the lungs. Nutrients come from the GIT. Oxygen takes blood takes oxygen from the lungs and takes nutrients from the digestive system, and then they are all distributed all over your body to all of your body cells, right? Because cells need oxygen, they need nutrients to function and to basically stay alive. We've got also metabolic waste products. Blood is not only good stuff, oxygen, it has some bad stuff, of course. It takes metabolic waste products from the cells and it takes them where? To the elimination sites. What are the elimination sites we have in our body?
Kidney.
Yes. Kidney, that's one example.
Lungs.
What else?
Lungs.
Lungs, that's correct. For the CO2 plate, nice. To the lungs to eliminate carbon dioxide, as our colleague said. Two, to the kidneys to dispose of nitrogenous waste in urine. There's also liver, plate. And also blood transports hormones from the endocrine glands. Of course, there are two types of glands. Exocrine, they don't secrete into blood. Endocrine do. And that's, they secrete the hormones into blood, and then blood carries them around the body until they find the receptor that combine to this hormone, and then make the function. Right. What does blood regulate? This is the second function of blood. What does blood regulate, guys? Help me out. Blood temperature. خلاص بدون رفع ايدي زدت جواب.
pH.
pH. What does blood regulate? You. What does it regulate? Anything.
Blood clotting.
Huh?
Clotting. Blood clotting.
Blood clotting? Okay. That's hyperprotection strategy. طيب. What does blood regulate? Appropriate body temperature. Your temperature around your body is not the same. صح? For example, here I have my hand is exposed. My upper chest button it's covered. Here the temperature is higher. Here it's colder. Blood moving from here to here, circulating around the body, it absorbs heat from places where heat is high, takes it to places where heat is low, and then heat is distributed all over the body. صح? Normal pH in the body. Blood also regulates the pH. How does it do that? There are blood proteins that you guys have studied in the Biochem 1 course. Blood proteins are buffers in the blood. They help to regulate blood pH. طيب. Also, there is some blood solutes that also do this function. Not only blood proteins. All right. طيب. Adequate fluid volume in the circulatory system. How does that happen, guys? For your body to, or for blood to be pushed around the circulation and stuff, it has to have a good amount of volume. Okay, it has to retain some fluid. Okay, to stay liquidy, not thick, and it won't be passing basically. So what retains this water inside blood? These are molecules that are kind of large, comparing them to other molecules. For example, proteins. Blood proteins are large, and that's why they have a high osmotic pressure. They absorb, they suck in water into the blood vessels. That's how blood stays liquidy, stays flowing, stays smooth. All right? Like, how does the blood protect? Here comes the example that Hassan said. Preventing blood loss. How does the blood prevent its own blood loss? When a wound happens, all right, there are platelets inside the blood. We'll take them in the components of blood. These platelets basically start accumulating at the site of injury, and then they will start to stop. They form a coagulation, they form a wound, they form to stop blood from moving outside of the body. Also, blood itself prevents infection in the body. How does it do that? There are blood cells, white blood cells, sorry. There are antibodies, there are complement proteins. All of those are in your blood. They also protect you. They move into tissues by the Imtiaz will explain that. They move into tissues and basically protect your tissues from any injury. All right? Like 17.2, 17.1 was easy and simple. 17.2, blood consists of plasma and formed elements. Guys, pretty important. Two main components of blood. Plasma, all right? Plasma and formed elements. Plasma will, okay. So let's go back. Plasma will constitute 55% of blood, 55%, and the rest will be formed elements, right? Which is 45%. What is blood? Blood, guys, you studied this in the tissues chapter back in term 1. Blood was what?
Connective tissue.
Type of connective tissue. It's the only fluid tissue in the body, and it's a type of connective tissue, as our friend Karim mentioned. Blood is a specialized connective tissue in which living blood cells called formed elements suspended in a non-living fluid matrix, which is the plasma. Okay. Tissues, as we've studied, guys, there were 3 main components of tissues: fibers, cells. What was the third one? I don't remember. Extracellular matrix. There were cells, fibers, and I think extracellular matrix. 3 components of blood, of tissues. All right. We have the cells, which are red blood cells, white blood cells. We have different types of cells. We have what else? We have the fluid, which is the plasma. We're lacking the third component of a tissue, which is the fibers. But those fibers are what? They are dissolved fibers. They are not clear. When do they appear? When the blood clot happens. You will start seeing that in the, Aicha will explain it. They will start forming fibers, basically. Major components of blood. This is what I just explained. This is the process of separating blood into its components, all right? We draw blood. You put it in a centrifuge. It's separated. The heaviest components are seen at the bottom. The lightest components are seen at the top. The lightest are what? It's plasma, all right? And it's 55%. It's not showing. It's 55%, all right? Of blood is plasma. What about the 45% left? We've got the formed elements, which include what? The erythrocytes and the buffy coat. All right? This is a 45% left. The buffy coat is what? It's leukocytes, which are white blood cells. It's also platelets. And this composes in total less than 1%. You can imagine less than 1% of your blood is white blood cells and platelets. Less than 1%, but they still protect your body. Right? Moving on to erythrocytes. They form the other 45%. If you add them up, 45, 155, you get 101%. Why is that? Because the leukocytes and platelets are less than 1%. They're not even 1%. So the other 45% is the red blood cells, only red blood cells, and this is called what? Hematocrit. Another term for the percentage of red blood cells in your body is hematocrit. And these are the most dense components. How are they separated? This is the heaviest, second heaviest, and the lightest. Okay? Right. Physical characteristics of body. Wallah, this is not going to say use this, but they won't ask you about it, so it's just for reading. The texture of blood is sticky. That's because of our red blood cells. The color is, it depends. This is important. The color of blood depends. It's not always red. It's red, but there's levels of red. Okay? When it's oxygenated, what's the color of blood when it's oxygenated? Scarlet or bright red. When it's deoxygenated, oxygen full, it becomes dark red. Right? You can, you should memorize the other names for bright red, scarlet and stuff, because they might use them instead of the real term to confuse you guys and stuff. Right? pH. pH of blood is very important to memorize. It's slightly alkaline. The neutral is 7. It's slightly alkaline, above 7. 35 to 45 pH, right? Density is definitely more dense than water. It's viscous, it's more dense and more viscous than water. Blood accounts for 8% of your body weight. طيب. طيب. Guys, plasma, we've said it forms how much percent of the blood? 55% of blood is plasma. This plasma is 90% water. Alright? Plasma is 90% water. The other 10% is what we're going to discover in a bit. Plasma proteins are the most abundant by weight. Okay. What are the most, of course I didn't mention yet the components of the 10%, but what would you think is the most abundant one? Of the,
By weight ولا number?
sorry?
Albumin.
Albumin, that's for the proteins. Electrolytes. They take up the most number of plasma, okay? Because they are very small.
في most abundant by number, most
Exactly.
abundant by weight.
Exactly. Most abundant by number is solutes. Or electrolytes, sorry. Electrolytes. Sodium plus potassium, calcium, whatever is there in your blood. The most abundant by weight, as Hassan mentioned, is albumin.
I didn't
Albumin is
mention.
the most abundant. It forms 60% of the plasma proteins. And 8%, we'll see that in a bit. Yeah. 8% of the plasma weight is plasma proteins. Alright? And 60% of those plasma proteins are albumin. Okay? Right. Yeah, most plasma proteins, they are synthesized where? In the liver. Except for two major exceptions. One is antibodies, which are also called gamma globulins. Where are they formed or what forms them? I'm not losing you guys, صح? You're good? Lymphocytes. انت تستاهلي 10 بعد. طيب. وحيد قاعد شايفه معنا يا جماعه. طيب. Lymphocytes, as she said, are the ones that
It's cancelled.
form antibodies. Which type of lymphocytes? B lymphocytes. They are the ones that form antibodies. So that's an exception for the liver forming proteins. Okay, we've got antibodies, which are proteins. They're formed by lymphocytes, B lymphocytes, not the liver. The other exception is what is hormones. Hormones. Some of hormones are proteins. Some hormones are steroid hormones, which are lipids and stuff. The other half of hormones is proteins. And those proteins are formed by what? Basically glands, not the liver. Alright? Albumin, as we said, is 60% of the proteins in the blood. Okay? It acts as a carrier to shuttle molecules. It moves molecules from place to place. And it's also the major blood protein contributing to the osmotic pressure of blood. You guys remember I just mentioned what? Blood proteins help blood retain water. صح? Stay liquidy. صح? Did I say that? You guys remember? But what is the major protein that contributes to this osmotic pressure? It's albumin. That's because it's the largest in size and it also forms the largest percentage, which is 60%. Fine.
Do electrolytes also do the same thing?
No,
Because the book mentions that they also contribute to osmotic
osmotic
pressure.
pressure? أنت شاطرة ما شاء الله.
So if we get a question, do we just answer proteins or both proteins?
They won't confuse you and get you the two correct answers in the same hobby, definitely. It will be one of them. But the major one is albumin. Electrolytes are small, as I said. That's why they are the most in number. Because they are so small. So they mostly don't contribute a lot to osmotic pressure. Okay? Because that depends on the size, as I said. Alright. The composition of plasma varies continuously. طبعا. Plasma is not constantly being this, and that. They're always changing. Organs take up some of the electrolytes. Other organ takes up some of the sugars. Other organ takes up. And they are always changing. Some add, some takes. Alright? Okay, guys are with me or not?
Yes.
ليه فات عن بالي؟ ركز معي. طيب, this table very important, very important. And I think it's here where زميلتنا انتبهت لهالملاحظة. Osmotic pressure is also done by electrolytes. She read the table, so you should memorize it. Memorize everything mentioned in it. Take it easy and try to link them. يعني they are pretty easy. And most of them are, we mentioned them. We said hormones. We said nutrients, we said proteins, we said electrolytes. Water is 90% easy. طيب, what are the formed elements? We've got three formed elements, main formed elements. One is red blood cells or erythrocytes. Second one is white blood cells or leukocytes. Third one is platelets. Now these three formed elements, they have some unusual features. Two of them are not even true cells. Which are those two?
RBCs and platelets.
Platelets. They are not true cells. Even though they're called red blood cells, they are cells, but they are not true cells. Why? We'll mention that in a bit. They don't have organelles, they don't have a nucleus. Okay? Erythrocytes and platelets are not true blood cells. White blood cells are the only true cells in the body. They have a nucleus, they have everything. They do a function, protect the body and stuff. They synthesize proteins and stuff. Most types of foreign elements survive in the bloodstream for only a few days. We will take how long each one takes or stays in the blood, stays alive in the blood. And yeah, we will mention how long does each one take in the blood, and they're mostly only a few days, not more than months, maybe 2 months, 3 months, for the highest one. Most blood cells do not divide. Blood cells do not divide. Instead, stem cells divide continuously in the red bone marrow to replace them. Where do all these foreign elements come from?
Red bone marrow.
All of them. And they all come from one main cell, which is
Hematopoietic stem cell.
hematopoietic stem cell, or also called hemocytoblast. That's correct. They all originate from there, no exceptions. 3 of them. Okay, 17.3. We're done with 17.1, 17.2. Erythrocytes play a crucial role in O2 and oxygen transport. Yes, we said it before. What does blood transport? We said oxygen, we said nutrients, we said metabolic waste. Now we'll focus on oxygen and CO2. طيب. And these are just descriptions and stuff. Red blood cells are shaped like what? Like a biconcave. Basically a donut. But it's not, doesn't have a hole in the middle. Okay? Why is that? You will see. You guys remember in term 1, you took something called the complementarity between structure and function. For you to study the structure of something, you might look at the function and you will realize why is it shaped like that. RBCs are not shaped like a biconcave shape for no reason. It is for a reason. And we'll say it. Alright? Okay, so we said that they are biconcave shaped. They don't have a nucleus, they do not have a nucleus, they do not have organelles. That's the reason why they are what? They're not considered as true cells, just like platelets. They have hemoglobin as the most abundant component. 97%, we mentioned that. 97% of what's inside the red blood cell is hemoglobin. Okay? What else do we have? We have something called spectrin, which is a structural protein. What is spectrin? Spectrin is a protein. This is the red blood cell, okay? We have the red blood cell here. Spectrin is attached to the cytoplasmic surface of the plasma membrane of the red blood cell, okay? يعني, guys, with me, صح? فاهمين علي؟ حلو. It's attached to the cytoplasmic surface, يعني, from the inside of the red blood cell, okay? What is the function of spectrin? Spectrin basically maintains the biconcave shape of the red blood cell. It keeps it in this shape, which is perfect for its function. That's what it needs for its function. And this spectrin, surprisingly, is deformable. Why is it deformable? You can play with it, basically. And the red blood cell is not biconcave all the time. It changes. Sometimes becomes sickle, this is in the case of disease. But in the case of not a disease, a healthy person, it has different shapes. It becomes different shapes. And we will, and how does it do that? By spectrin. Spectrin is deformable. That's how the red blood cell changes its shape. Why does the red blood cell change its shape? You guys will study the blood vessels chapter, okay, this term. You will notice that some capillaries are very, very low in diameter or size, very low. A red blood cell, barely one red blood cell can pass through a capillary. So that's why they have to sometimes, يتحرك هيك شوية عشان يدخل جوا. Alright? طيب. Okay. Yeah. Also surprising information, red blood cells, alright, not only take up, or hemoglobin, not only takes up oxygen, that's what you guys mostly know. The blood cell goes to the lung, takes oxygen to the tissue, صح? But it also, those erythrocytes, this hemoglobin in erythrocytes also takes up what? Carbon dioxide. Specifically 20% of the carbon dioxide that your body produces is bound to hemoglobin. Hemoglobin that binds oxygen, right? طيب, 3 structural characteristics contribute to erythrocyte health. You guys remember what I said about the complementarity of structure and function? Erythrocytes are shaped like a biconcave for a reason, and other things that they are all for a reason. What are those things? They are small in size. Why are they small in size? Because capillaries, as we said, are very, very tiny, small. 10 micrometers in diameter maybe. Red blood cell, by the way, is 7.5 micrometers in diameter. So the smallest capillary is basically maybe the size of a single red blood cell, or maybe a little less, a little more. Alright? So, the small size is very important. They have a huge surface area. Now we come to the what? To the biconcave shape. Why are they shaped like a biconcave shape? That's for 2 reasons.
Because they are enucleate
Hello.
and to carry more oxygen. That helps.
Carry more oxygen. That's the one you said. But the other one, لا Malak. Why are they shaped like a biconcave? They are shaped like a biconcave dish. That increases their surface area. Guys, you remember, or you didn't take it maybe, بالintestines, alright, why do they have all this microvilli, والvilli, ومش عارف شو? Increase surface area. So basically, بالintestine بتشوفوا كل التعرجات. بالبلد blood cells you only see the small one. But what does this small concavity do? It increases the surface area 30% more than a normal spherical cell. If it was completely spherical. Okay? So we 30% more. يعني this is huge for your body. يعني it's not simple number. Okay? Also, this biconcave shape, in addition to it increasing the surface area, it also makes what? It doesn't allow for a single hemoglobin inside the red blood cell to be away from the cytoplasm. Why does it have to be the hemoglobin? Why does it have to be close from cytoplasm? To bind to oxygen. When you have all those hemoglobin molecules all distributed at a تقريبا constant space from the cytoplasm, from the plasma membrane, they all get the exact amount of oxygen تقريبا. Okay? No hemoglobin is left in the middle. يعني imagine with me هسه كرة. Okay? We have hemoglobin نص الكرة. Will it get any oxygen? It's in the middle بالنص ما حيوصلك شيء يعني أبدا. This biconcavity, this shape helps all the hemoglobin molecules to get oxygen, enough oxygen. Okay, another important characteristic, as I said guys, hemoglobin forms over 97% of the content of a erythrocyte. Why is that? Hemoglobin is, it's the molecule that binds to respiratory gas. انتبهوا, we said respiratory gas, not only oxygen, also carbon dioxide. Alright? يعني you can imagine guys, يعني how perfect this is, subhanallah. A red blood cell, biconcave shape makes the surface area more oxygen binds. In addition to that, 97 of it already is hemoglobin. يعني what else? Subhanallah. Okay? The third characteristic, yes, because erythrocytes lack, we said organelles, صح? We said they lack organelles. What are the organelles? We've got nucleus, mitochondria, يعني many of them. But the most important one that it's lacking is the mitochondria. Why is that? What does the mitochondria allow us to do?
Generate
Aerobic respiration, use oxygen. This erythrocyte is saving oxygen for your body. It doesn't make sense for it to consume this oxygen that's already delivering it to you? Doesn't make sense. That's why it doesn't have a mitochondria. فيعني the 97% of hemoglobin there, every single one of them that binds to oxygen will deliver this oxygen. No oxygen will be used. Okay? What are the functions of erythrocytes? Hello. They are completely dedicated to their function. What are the functions of red blood cells? We'll discuss it, guys. Okay? What are the functions of red blood cells? They are mainly there. They are dedicated to transport respiratory gases. Those are oxygen, carbon dioxide. Mainly oxygen, of course, but we said carbon dioxide. 20% of the carbon dioxide in that is produced by the tissues is taken by hemoglobin. Hello. Males have higher levels of hemoglobin than females. Guys, we'll take this, it will be mentioned so many times. They have more hemoglobin. Males and females. Males have more hemoglobin. They have more blood volume. They have more red blood cells. Everything is more in males than females. Why is that? We will mention some of the reasons. حلو. Hemoglobin is made up of the حلو. Now for the components of hemoglobin, what is hemoglobin? What does it consist of? Hemoglobin is basically a globin part, and it's called hemoglobin, صح? Heme and globin. Heme is what? Heme is basically an iron in the middle, and there are some stuff you don't have to know around the iron. What about the globin? The globin is basically a protein. It has 4 chains, 2 alpha, 2 beta. Alright? And this is one hemoglobin molecule. Imagine with me, one hemoglobin molecule, 2 alpha, 2 beta. Each one of those has a heme. So 4 heme, 4 iron. Okay? So one hemoglobin, how many oxygen does it bind? 4. Sorry. Yeah. This is pretty subhanallah kaman. Each red blood cell can take up to 1 billion molecules of oxygen. That's why, because we said 97% already of it is hemoglobin. And this hemoglobin, each one combines 4. A single red blood cell has almost 250 million hemoglobin molecules. So 250 million times 4 is a billion. Right? Make sense? Does it make sense, guys? This is what I explained basically. These are the 2 beta chains. Each one has a heme. Okay, 4 hemes. A single hemoglobin combined to 4 oxygen molecules. So we've got the 2 beta, 2 alpha. Okay, each one has a heme. 2 alpha, 2 beta, each one has a heme. That's the hemoglobin. What is hemoglobin? Why is hemoglobin? This is very important. This is a small sentence in your book. This is a very small sentence in your book, but we have to mention it. Why is hemoglobin contained within erythrocytes?
It's toxic.
Huh?
It's toxic.
It's toxic, maybe. I will mention the reasons. Wait. Why is hemoglobin?
For the kidneys.
For the kidneys, exactly. It's a small sentence in the book, but we have to mention 2 reasons why is hemoglobin. They're asking me to kind of, hey guys, I'm sorry, we're short on time, but inshallah you will understand. There are the slides available for you. We'll set them on important for you guys to revise on them if you want. I've included mostly everything. If you want to revise for your quiz, revise from the slides you can, if you want. Okay, so 2 main reasons why why is hemoglobin in erythrocytes, not 3 in the plasma. 1, prevent leaking out of the bloodstream and clogging up in the kidneys. Guys, kidneys filter blood. When those hemoglobin molecules, they are very small, they are filtered by the kidney. Your urine will be full of hemoglobin, full of blood, and basically you're losing hemoglobin. So this is not optimal. It doesn't work at all. Also, large amounts of hemoglobin in the blood would make blood more viscous. Blood more viscous, thick, doesn't flow well, strokes, coagulation, kada. Blood is needed to be in a state flow, always flowing. Lazim. Okay? 2 main reasons, very important. The process of gas transport. Guys, blood goes to the lungs. Blood goes to the lungs. It's deoxygenated because oxygen was used by the tissues. In the lungs, it takes up oxygen. It binds to oxygen in the lungs. It becomes what? It becomes oxyhemoglobin. Okay? Oxyhemoglobin is also called what? No? Oxygenated hemoglobin. Oxyhemoglobin. Okay. And it also assumes a new 3-dimensional shape. And the change of hemoglobin kind of changes a little bit due to the binding of oxygen to iron. Okay? In the body tissues, after it had taken all the oxygen from the lungs, it goes to the tissues. In the tissues, what happens? Tissues will reverse the process. They will take up oxygen, they will give off carbon dioxide. So hemoglobin, which was oxyhemoglobin, it's bound to oxygen. Now it removed, the oxygen is removed from it. What happens? منطقيا لما ارتبطت بالاكسجين حيتغير شكلها شوي. لما تركت الاكسجين it goes back to its former shape. صح? Makes sense. What else? It also becomes it's also called deoxyhemoglobin, or also called, this is what I meant before, reduced hemoglobin. Reduced hemoglobin is basically hemoglobin that is not bound to an oxygen. Okay? And it also becomes dark red. Very important, guys. It also becomes dark red because it's deoxygenated. حلو. As you said, 20% of carbon dioxide released by the tissues is bound to hemoglobin in blood. Okay? Okay, this is important. We said hemoglobin bound to oxygen. What is it called? Oxyhemoglobin. Without oxygen? Deoxy or reduced hemoglobin. When it's bound to carbon dioxide, we call it carbaminohemoglobin. Alright? When hemoglobin is in the reduced state, the formation of carbaminohemoglobin becomes more likely to happen when hemoglobin is what? Is in the reduced state, in the deoxygenated state. I think about it. Hemoglobin is carrying oxygen right now. Take CO2, will you take it? I already have my oxygen, this is what I want. But when I'm deoxygenated, reduced, what happens? You want to give me CO2, I will take it. Okay? So it's easier when it's not bound to oxygen. Basically, why would I lift every week? Basically. Production of erythrocytes. Guys, this is for you to read, but I will explain from the figure. Wait. Figure? Here's the figure. Production of erythrocytes. It's called what? Erythropoiesis. Hematopoiesis is what? Formation of any blood in general. It's hematopoiesis. Heme is blood. Hematopoiesis is formation of blood. Erythropoiesis is the formation of red blood cells specifically because they're called erythrocytes. Makes sense, right? What are the stages? Guys, we said this is the origin. We start with what? Hematopoietic stem cell. This is the origin of all cells or any formed elements. Okay? We start with hematopoietic stem cell. It goes into something called myeloid stem cell. It's not mentioned here. Okay? Myeloid stem cell. From myeloid stem cell to proerythroblast. It's called proerythroblast. Okay? From the pro-erythroblasts it goes to, you guys just memorize their names one by one, حافظين. From pro-erythroblast to the basophilic erythroblast. Here you have to know one important thing about the basophilic erythroblast. Why is it called basophilic? Because it has so many ribosomes. Ribosomes are basophilic, okay? Why does it need ribosomes? It needs ribosomes to, what do ribosomes do? Synthesize protein. So these basophilic erythroblasts, they have so many ribosomes, they synthesize so many proteins. Why is this protein needed? Hemoglobin. The globin part of hemoglobin. Okay? As they start synthesizing hemoglobin, think about it. Red, offer, it was basic, it was blue, it was so many ribosomes. Now we're having kind of hemoglobin. Hemoglobin is red. Okay? So blue with red, it starts kind of getting what? يعني mixed colors. Blue مع red يعطي شوي pink مثلا. Okay? So that's why it's called polychromatic. You guys just don't just memorize, understand the name. Polychromatic, متعدد ألوان. Okay? Many colors. Polychromatic erythroblast. After that, it starts synthesizing more and more hemoglobin. It becomes even more red. Orthochromatic erythroblast. One color. Anyway, so in this state, the cell had clumped most of its ribosomes and synthesized as much hemoglobin as it can. And it's called an orthochromatic erythroblast. From there, it goes to the reticulocyte. Why is it called the reticulocyte? Because it has networks of ribosomes. The reticulum is a network. It has so many ribosomes that are still clumped. It will eject those ribosomes and become an erythrocyte. Come on. You guys read it again if you didn't understand it. Stage of erythropoiesis. حلو. شو هذا الكلام؟ حلو. hematopoiesis. Okay, this is important to know. How is this process controlled? It's controlled hormonally. Okay, hormones are secreted. What hormones? We'll mention them. What is needed? You have the hormone to give the signal. But what do you need to build? You need material. صح? What do you need? Iron, amino acids, beta vitamins. Iron for the heme group. صح? Amino acids for the globin. B vitamins we will have for the cell membrane. Erythropoietin, this is the hormone. Okay. Hormonal controls of erythropoiesis. Hormones control erythropoiesis. What hormones? Erythropoietin. Okay? Very important. Memorize it. This is the hormone that synthesizes or signals the cells to start the bone marrow to start synthesizing red blood cells. How is it produced? It's produced by the kidneys. They play the main role in producing erythropoietin. What else produces it? The liver produces some of it. Okay? How does that happen, guys? Subhanallah again. You become hypoxic. And when does your body need to synthesize red blood cells? Normally it's at a constant rate. Okay? There is always erythropoietin in the blood. It's always signaling bone marrow to synthesize red blood cells at a constant rate. حلو? Which is viable. You can live with it. What happens or why does erythropoietin increase? It increases when your oxygen levels decrease. When does your oxygen levels decrease? You have anemia. You have an injury. You lost blood. Your body starts knowing that. How does it know? We'll mention. Basically, it starts knowing that there's less ability of blood to deliver oxygen. So that's why it signals the bone marrow to start synthesizing more red blood cells. How does that happen? When certain kidney cells become hypoxic, they are oxygen deficient. Oxygen sensitive enzymes carry out their normal function of degrading the intercellular health. Guys, HIF, this is a very important factor. It's called hypoxia-inducible factor. What does this molecule do? This molecule normally they degrade intercellular signaling molecules. لا ثواني. Enzymes are unable to carry out their normal function. حلو. Guys, hypoxia-inducible factor, let me correct myself. It's normally destroyed by some enzymes. Those enzymes are sensitive to oxygen. When oxygen becomes less in the body, those enzymes are unable to destroy HIF. Okay? When oxygen is normal in the body, they destroy HIF. So HIF does not give a signal to the kidney to produce erythropoietin. حلو؟ طيب معايا يا شباب. But when oxygen drops, those enzymes that destroy HIF, they start functioning. They don't function when oxygen is good. They only function when oxygen is low. حلو؟ فهمتوني؟ حضار؟ طيب. طيب والله معلش يا شباب هذا البارت كمان يكون واضح.
When HIF accumulates, more erythropoietin produced.
Why will it accumulate? Because the enzymes that destroy it are not there. Why are they not there? Because we have low oxygen.
Low oxygen. Yeah,
we have good oxygen.
No, low.
عيد ايش قلت انت؟
when HIF starts to accumulate,
حلو.
more erythropoietin are being produced.
حلو.
More
Why
red
this
blood cells.
accumulates? Because this says the enzymes that destroy it are not there. Why are they not there? Because we have no oxygen.
No oxygen.
تمام حلو أعطيك العافية. Hormonal controls of erythropoiesis, guys. حلو. حلو. Why would we synthesize more red blood cells? I just mentioned the reason. Having less blood, يعني injury, whatever. But these are the three main reasons. Reduce number of red blood cells. For example, in hemorrhage or bleeding, when you bleed, you lose red blood cells. Your enzymes, those that destroy HIF, are unable to work. So HIF, why are they unable to work? Because you don't have enough oxygen. So they signal the kidney to produce erythropoietin. طيب, insufficient hemoglobin, as in iron deficiency, or reduced availability of oxygen, as might occur at high altitudes. Okay, so there are many reasons for oxygen to decrease. It doesn't have to be bleeding. You guys read them and you understand. طيب, homeostatic imbalance, guys. Some athletes take up erythropoietin illegally. Why? To increase the red blood cells. Why would they increase the red blood cells? Basically, they will have more stamina. More stamina. حلو. But this can be deadly. Why? Because when they take up erythropoietin, their body increases the red blood cells, but it was not going to do that. You did it to yourself. And your body didn't signal this normally. You injected erythropoietin and you signaled the body to produce red blood cells. This what will cause? This will cause the blood to become thick, more red blood cells. Okay, and under the condition of exercising and stuff, you will lose water, you will lose kada, more red blood cells, less water, blood is sticky. It will be clotting, stroke, heart failure, many things could happen. Right? The dietary requirements to make red blood cells. The raw materials to make erythropoiesis. The raw materials required for erythropoiesis include nutrients. Nutrients are amino acids, lipids. Amino acids, why? For the plasma membrane to have proteins, transmembrane proteins, peripheral proteins, whatever. Lipids for the plasma membrane. Remember, we're making red blood cells. They are cells. They have a cell membrane. Okay. And carbohydrates for مثلا identity of the cell. Okay. Okay. Two beta complex vitamins, B12 and folic acid is B9. They might use this in the exam instead of folic acid B9. Necessary for normal DNA synthesis. They are necessary for normal DNA synthesis. Each side effect can be jeopardized. Iron, we need iron for hemoglobin, guys. Basically. The requirements, you guys read this one while we're short on time. You just read it and you'll understand it, okay? But basically, iron in the blood is where do we take iron from? From the food. So, who does that? The intestinal cells. حلو. Where is iron stored? In the liver, spleen, and in the bone marrow to a lower extent. حلو. If we have iron in the blood, free it will be toxic. How is it transported then? There's ferritin and there's hemosiderin. حلو. Those are where inside the cell. Ferritin and hemosiderin are inside the cells. But in the blood, free iron is not allowed. It will be transferred by transferrin. حلو. A protein. Fate and destruction of red blood cells. Red blood cells only live from 100 to 120 days. As we said, most of them are in days. ما حد يتخطى 4 أشهر مثلا أي خلية في الدم. Okay? They are anucleate. Okay, we know that. Why are red blood cells destroyed after 120 days, for example? They lose their flexibility. They become increasingly rigid and fragile. Basically, مع السبكترم, you guys remember spectrum? بيشد بيخفف بيشد. مثلا عندك ربر هتقعد تشدها اخر شيء حتفرط ما won't be the same as it was before, so you have to خلاص throw it. Same thing. And who does this function of destroying erythrocytes? It's macrophages. Where? In the spleen. Fate and destruction. حلو. Guys, the heme, which was what? Iron, and some molecules around it. What happens to it? The heme of hemoglobin is split off from the globin. We have heme and globin now. Each one is on its own. The core iron of heme, it's salvaged. It's bound to مثلا ferritin, hemosiderin. The body basically recycles it. It uses it again. What about the rest of the heme group? It's degraded to bilirubin. Okay, bilirubin is a yellow pigment that is released to the blood and it binds to albumin for transport. Heme, the rest of the heme group. Okay, and the iron, the rest of the heme group is converted to bilirubin. It's transported by albumin to the liver. Okay, the liver, what does it do? It secretes it into the intestine as what? As secretes in bile. حلو. In the intestine, the liver secretes the rest of the heme as bile in the intestine. what happens to the bile in the intestine? It's converted to urobilinogen, which is the great, it's a pigment that basically found in feces. This is the figure. This is the figure, guys. Read it. It basically summarizes what happened here. What are the erythrocyte disorders? Two main disorders, guys: anemia and polycythemia. Hello. What happens in anemia? In anemia, the blood's capacity to carry oxygen is low. Hello. It cannot support metabolism. Hello. It's a sign of a disorder rather than a disease itself. It's not a disease, anemia. It's a sign of something else. We'll have to figure it out. Hello. What are the signs and symptoms of patients with anemia? Important. Remember those: fatigue, pale, shortness of breath, and chill. They feel cold. Polycythemia is the opposite, where red blood cells are in more number than excess number of red blood cells, increased blood viscosity, causing it to flow sluggishly, thickly, and it causes viscous. The causes, will start with anemia and then we'll go to the polycythemia. Anemia, there are three main reasons for anemia: blood loss, not enough red blood cells are produced, or too many of them are destroyed. They make sense. We'll go for the first reason: blood loss. Okay, it's called what? It's called hemorrhagic anemia. It's caused by blood loss. There are two types, guys. Very important: acute hemorrhagic anemia and chronic hemorrhagic anemia. What happens in the acute one? In the acute one, it's rapid. يعني مثل حطانك الدم عم يطلع بسرعة. Okay? This is what this is acute. It's rapid, a severe stab wound. It's treated by what? It's just treated by covering this wound, stopping blood from flowing outside your body, and replacing the lost blood. Okay? What about chronic? Chronic happens in examples we have here: hemorrhoids, which is bawasir, undiagnosed bleeding ulcer, but those are what they are persistent at a very long time and at a very small amount. يعني مثلا واحد عنده hemorrhoids for 3 months, 4 months. For 4 months, 3 months, his body is excreting a little bit amount of blood with feces. طيب, as it persists, it develops to anemia. طيب, you're losing a small amount of blood, but this small amount is on a very long time, and that's why it causes anemia. Timer كم timer?
42.
طيب, we'll go for the second reason. We said the first reason is blood loss. The second reason is what? Not enough red blood cells are produced. طيب, when is the number of red blood cells is not enough? They are not produced in a normal, enough amount. When, these problems range. We'll take them one by one. There are a few types of anemia that they cause what? They cause red blood cells to not be produced in a normal amount. Okay, the first one is iron deficiency anemia. Think about it. You don't have enough iron in your body. Hemoglobin, what is it gonna use? There's no iron. Iron is needed for binding to oxygen. So your body basically does not have enough iron to make hemoglobin for those RBCs to function. Okay? And they are the cells which are produced when you have iron deficiency anemia. They're called microcytes. They are small in size and pale. Why is that? Think about it. Pale, why? Or small, why? Because you don't have enough hemoglobin to يغطي المساحة كلها ويعبي الخلية كلها. Right? Why are they pale? Because you don't have enough hemoglobin. The red color of hemoglobin is mainly from iron. طيب, when you don't have iron, there's no color, no red color for red blood cells. Okay. The second type, we're still in the not enough cells are produced. Okay. The second type is pernicious anemia. It's an autoimmune disease. Okay. The body immune cells, they attack the intestines. They attack cells in the intestines. These cells normally what produce intrinsic factor. What is intrinsic factor? It's needed for vitamin B12 to be absorbed in the body. We took up vitamin B12 in the things needed for erythrocytes to be to form. Why is it needed? It was needed for the to form the DNA. Okay. So when these cells grow, they cannot divide, and they are called macrocytes. So basically the cell, I think the hematocytoblast will grow in size. At a point, it will start to need to divide, but there is no vitamin B12. There is no DNA synthesis, so it won't divide. It will just increase in size, but there is nothing signaling it to divide. So basically, it will just become large, and it basically become large and pale. Also, guys, there's a term for pale, which was called hypochromatic. صح? Hypochromatic. They were using it in the exam. And what you were taught in EMS last term, you will need it. There's hypochromatic. They will use it instead of pale, for example. So you guys take a look on these. Yeah, okay. So how do we solve this? For the previous one, we said what? You replace the blood loss. Now we go to what? You don't have enough vitamin B12. So you will try to what? Intramuscularly inject vitamin B12 or apply a gel to the nasal lining once a week of vitamin B12. It will be absorbed in your body just like you're taking it from food and stuff. Right? Okay. Yeah, vitamin or pernicious anemia. The iron deficiency, we said you don't have enough iron. But the vitamin B12, it can also happen in people due to their diet. What people? Vegetarians. They don't eat enough meat. Meat has vitamin B12. So when they don't eat enough meat, enough vitamin B12 is taken into their bodies, and so they develop pernicious anemia. But these are severe cases of vegetarian people. Renal anemia is basically renal is kidney. The kidney produces EPO. When your body is unable to produce EPO, you're not unable to signal your bone marrow to produce red blood cells, you will develop renal anemia. Hello? Hello. Why does it happen, صح? Kidneys are unable to produce erythropoietin. What kidneys cannot produce erythropoietin? Damaged kidneys, they have whatever disease it is. Okay? Next type, we've got aplastic anemia. Hello. This is the last one, and not enough red blood cells are produced. This one, it's more severe than an anemia. Anemia is just a simple part of it. Okay? But what it does is that it inhibits the red bone marrow. The red bone marrow that synthesizes the red blood cells, platelets, white blood cells. So that's why there will be defects in blood clotting because there's not enough platelets. And immunity as well because there's not enough white blood cells. Alright? Why? Too much. Too many blood cells, I'm sure. هذا is a huge chapter, but time is not enough. طيب, it's an easy chapter guys. والله mostly reading and memorizing. يعني 3 marks حافين يعني حافظوا اللي حاطين إياه في البداية صراحة. طيب. You guys read this. Okay. طيب, what about too many red blood cells are destroyed? When are red blood cells are destroyed? 2 cases. Mentioned in the book. Thalassemia and sickle cell anemia. Alright? Thalassemia, what happens? One of the globin chains, we don't know which one, is absent or faulty, either alpha or beta. Hello? Erythrocytes are thin, delicate, and deficient in hemoglobin basically. These will also be hypochromic, I think, because they don't have enough hemoglobin. I think so. I'll be sending this on the report, inshallah, regarding this. Hello? طيب. Sickle cell anemia, what about it? I think most of you have studied this one in the high school, sickle cell anemia. But what happens is basically one amino acid of the beta chain of hemoglobin is changed. What is this, inshallah, when I added the picture? Maybe I didn't.
Number 6.
Huh?
Amino acid number 6.
6, but
valine to glutamine.
Like glutamine, something like that. Like glutamine to valine.
Yeah, it is.
Yeah?
It is.
What's it?
To valine.
Glutamine to valine.
Glutamic acid to valine.
Which one to valine?
Glutamic acid to
To
valine.
valine.
حلو.
Reserve a chocolate.
والله يا انت deserve.
Whoever answers.
معلش والله يا شباب على الاسلوب يعني. تفضل.
Thank you.
تفضل. Okay, sickle cell anemia basically one amino acid changes. This change one amino acid of 146, it will cause the cells to sickle. They become S-shaped. And what happens when they become S-shaped? They are not S-shaped on all the times. It's only when there are low oxygen levels. Okay, they sickle. طيب. What are some symptoms of this, of the sickle cell anemia? Bone and chest pain, infection, stroke, blood transfusion. Blood transfusion is needed to solve sickle cell anemia. But it can be also solved by what? Taking nitric oxide to dilate blood vessels. Important guys. Nitric oxide is taken to يوسع blood vessels. They can يتعودوا or they can cope up with the sickle cell anemia shape. طيب. Why would they persist in the population? يعني هاي والله ما ماشيينها اصلا. بس basically guys in Africa they have what? Malaria. حلو. Malaria سبحان الله. If you have sickle cell anemia it will protect you from malaria. How does that happen? We said sickle cell anemia, when do cells sickle? When there's low oxygen levels. حلو. And also when there's the شو اسمه هذا? malaria bacteria on them. So when they sickle, when the malaria bacteria is on them, عارفين أي red blood cell هيجيها malaria bacterium, it will sickle. What will happen to this cell? It will be eaten by macrophages or whatever. So basically those who have malaria and sickle cell anemia will protect them from malaria. That's why حرفيا يمكن صاروا يتقصدوا يتزوجوا عشان يجيبوا اولاد بالملاريا عشان تحميهم من السكرسانيا. والسكرسانيا تحميهم. حلو. جلوتامين وش اسمه هذا؟ حلو. هذا شو جلوتاميت؟
Glutamate.
Glutamic acid to value. This is the only one amino acid that changes in sickle cell anemia. Polycythemia, guys, the second disorder. Your hematocrit increases. Okay? طيب. Polycythemia, guys, increase red blood cells. حلو. حلو. They become blood becomes viscous because of the increased red blood cells. حلو. حلو. It happens what? Polycythemia vera. Polycythemia vera is what? It's a bone marrow cancer. حلو. It's a type of bone marrow cancer. Characterized by dizziness and an exceptionally high red blood cell 8 to 11 million. What was the normal, guys, number of red blood cells?
4 to 1.
4 to 5, I think 6, yeah, 4 to 6, 7 actually. In this vera, it increased to 8, from 8 to 11 million cells. Hello per microliter. The hematocrit was the normal what? The normal for hematocrit was what? 45%. It might increase to 80%. And this is huge. Blood will be so viscous, so thick. يا دوبك يعني يعيش. How is it treated? By removing some blood, a procedure called therapeutic phlebotomy. Hello? Secondary polycythemia, when does it happen? It happens when you're living in an area where there is oxygen, high altitudes for example. Hello? What happens there? Your body is sensing that you are not taking enough oxygen. More erythropoietin is produced, red blood cells will increase slightly, not to 80%. And slightly, it will be still viable. To 6 to 8 million cells, which is about 2 million more than a normal person. This one is the exact same as the homeostatic imbalance that we mentioned before. They take erythropoietin, those athletes, it increases their red blood cells, more قابل انه يحصل على stroke, heart failure, whatever it is. حلو. We've got a question, guys. بسرعة. Read an answer and take your snack. حتى لو جاوبت غلط. بسرعة. شلف أنا آسف. Yes.
إيه؟
بالعربي. وحش. اجت عليك هذا. اوكي. Second question. بسرعة. شلف ما في شيء. Yes. Any hands? Yes.
C.
B. But you still take. Why is it B? Wallah, I will not explain, guys. I'm sorry, wallah. I might send it on the important, but we don't have that. Next question. بسرعة. Easy.
Red blood cells are 35%.
So B. لا.
No, D.
شاطر قبل.
إيه؟
شاطرك.
خلص كده.
Answer. بسرعة. بسرعة.
Polycythemia.
هم؟
Polycythemia.
بويسايثيميا. حد عنده جواب؟ غير الشباب الطيبة. بويسايثيميا. It is بويسايثيميا. يلا شباب بسرعة. Yeah, this is what I mentioned. The slide on my own is hello.
Normocytic.
Wait a second. Why is it like?
It's normocytic because
No, مش عيدي. وحش. هذا كان عنده جواب فايدة وحش. حلو. 17.4 finally. 17.4 continuing. The leukocytes defend the body. This Adi, I'll explain just half of it and Aicha will continue inshallah. حلو. General structural and functional characteristics. Red blood cells are confined to the skin. حلو. Obvious. حلو. Red blood cells, what did we say? They are only in the red blood, in the vessels. They don't usually go to tissues. That's abnormal. What goes to tissues? White blood cells. How do they do it? It's a process called diaphysis. Diaphysis is just white blood cells leaving the blood vessels. Hello? Yeah, what happens basically? You get an injury in one tissue in your body. Okay? At this injury, cells in your blood vessel will start showing what? Adhesion molecules. Those adhesion molecules will bind what? White blood cells. Those white blood cells will bind to adhesion molecules, and what after that, what will happen? They will start diaphoresis. They will start leaving the blood vessel and go into the tissue. How do they move? Well, once they're inside the tissue, how do they move? They move by amoeboid motion. What happens in amoeboid motion? Basically something called positive hemotaxis. Chemicals start attracting them inside the tissue. برا التissue أو بالبلد vessel, what attracts them to the injury? Cell adhesion molecules. Hello? Hello. What is leukocytosis? Okay. Really? A white blood cell count of over 11. The normal was 4,800 to 6,000. Alright, hello. So 11 is increasing. A normal response to an infection. It's normal. Leukocytosis. As long as it's 11,000 cells per microliter, this is normal. And it's a normal response to what infection? Hello? Hello. Leukocytes are grouped into two main groups, granulocytes and agranulocytes. From the name, granulocytes, what do they have? They have cytoplasmic granules. Agranulocytes, A is basically the opposite. They don't have granules. Hello? How to memorize their names from the most abundant to the least abundant. This is the, what is it called? Mnemonic mentioned in your book. Never let monkeys eat banana. N for neutrophils. They are the most abundant. Let lymphocytes, second most abundant. Monocytes, third. Eosinophils and basophils, last. Hello, hello. Granulocytes. There are three. The first one and the last two in the mnemonic. Never let monkeys eat bananas. Never let monkeys skip it, eat bananas. Okay, so neutrophils, eosinophils, and basophils. They are characterized by what they have, in addition to their granules, they have lobed nuclei. Their nuclei have divisions. Hello? Lobes. And they have membrane-bound cytoplasmic granules, as you said. Hello. These are the three: neutrophils, eosinophils, and basophils. What are neutrophils? Hello. They are the most numerous. They are in the first in the mnemonic. صح? Never let monkeys. Never neutrophils. They are the most abundant. 50-70% memorize their names. They have granules, but they are fine. Hello. They are fine granules, and they are what? Neutrophils is neutral, loving neutral. Those granules take up both acidic and basic dyes. Okay, they take up both acidic and basic dyes. That's why they're called neutrophils. Hello. Some of these granules contain hydrolytic enzymes, and those granules that contain hydrolytic enzymes are called what? Lysosomes. Others, especially the smaller, they have what? Antimicrobial protein called defensin. Hello. Hello. Their nuclei, those neutrophils, are divided into 3 to 6 lobes. Hello? Hello. They're also called, neutrophils are also called polymorphonuclear leukocytes, or PMNs, or syndipoles. Neutrophils are basically, whenever you hear bacteria, acute, a disease that doesn't last long and it's related to bacteria, these are what? Neutrophils. Hello? Acute bacterial infection. Acute is very important. Bacterial infections that are acute, such as what? Meningitis, appendicitis, whatever. Neutrophils are chemically attracted to the sites of inflammation and are active phagocytes. They phagocyte factors. They are especially for what? Bacteria and fungi. Hello? Hello. One way that they kill bacteria is by what? By respiratory burst. Hello? What happens in respiratory burst? They take up a pathogen, they synthesize something with the Clorox stuff or Clorox تنظيف, often bleach. They synthesize something related to it from oxygen, and they basically start killing this pathogen by يزتوا عليه هذا الكلور. حلو. In addition, they have defenses. We've mentioned defenses in the book. What do defenses do? حلو. حلو. Defenses, granules that have defenses, they bind or they combine with the granule that has a disease, a bacteria. Once they bind together, those defenses will what? Pierce holes in the membrane of the digested foe bacteria. And bacteria basic class. يعني انت جبتها من غرفتها اللي فيها ما فيها شيء، حطيتها مع مدري اسلحه والسيوف وقلت لهم يلا ادخلوا في بعض، حتموت حتتدمر. What are eosinophils? Then the second one. حلو. Neutrophils, eosinophils now. حلو. We're taking granulocytes now. They are the fourth, صح؟ لا third, fourth. Never let monkeys eat. They're the fourth in order. How much percent? 2 to 4%. They have what? 2 lobes. هنا كم قلنا؟ 6? 3-6. Hello. Here we have only 2 lobes. Hello. They're called eosin. Eosin is a dye, guys. It's red in color. So that's why when you stain them, you look at them in the microscope, you see what? Brick red color. Hello. they have granules. These granules are like lysozyme, نفس اللي كان بالنيوتروفيل, but they are filled with a unique variety of digestive enzymes. حلو, they have digestive enzyme that's kind of unique. Why is it unique? Because unlike the typical lysosomes, these lysosomes they lack enzymes that are specific to digest bacteria. But so they don't digest bacteria. What do they digest? Parasitic worms. Parasitic worm is large. Does the cell, eosinophil, take up the whole worm and kill it inside? No. They gather around this worm. They all start secreting those lysosomes, and basically this kills the worm. Hello. Types of worms are mentioned. Hello. They are too large to be phagocytized mentioned. Raw fish, important. And examples are important to read you in the exam. You might say that it's not important. Raw fish should be raw fish, but it may give you a clue inside the exam. Hello. Eosinophils. Hello. High important here. Side note, but it's very important. They have to do with allergies and asthma. Hello. They contribute. Guys, read this one. Okay, just read. The slides, as I told you, if you want to revise after reading the book enough, slides will be very good for you. You have questions? Well summarized, but we don't have time to read everything basically. What are basophils? The third type of granulocytes and the last type. Hello? They count for what? 0.5. What are they in the order? Bananas. Fifth, 0.5 to 1%. Hello? The cytoplasm is large. Hello. What do they have? They have granules that contain what? Histamine. Hello? Why are they called basophiles? They like basic. Because they take up what? Basic dyes. So they are what? Blue in color under the microscope. Hello? Hello. Histamine, what is it? A vasodilator. You guys know this? The purple nucleus, guys, very important note, carry this, the nihayat leukocytes. When they mention the characteristics of white blood cells, hello, they're not just use this U-shaped, S-shaped, bilobed, 3 to 6 lobes. They will ask you a question in the exam, which one attacks bacteria? They won't say neutrophils. They will use a characteristic of the neutrophil. يعني the one that has 3 to 6 lobes. Like you find in the answer, the one that has 3 to 6 lobes. So you know that this is neutrophil, so you choose the answer. Okay? They won't say neutrophils, the hal. No, they will use these clues that are mentioned in the book about each single one of them, and basically you have to use this information to guide yourself to the answer. A granulocytes are two types: lymphocytes and monocytes. Hello. Lymphocytes, starting with lymphocytes, they are the second in order, 25%. What are they? They are large. They have a dark purple nucleus. It occupies most of the cell volume. The nucleus is usually spherical. It may be slightly indented. You guys read this. Hello. Lymphocytes. Some of them are found in the bloodstream, but they are mainly where? In the tissues. Because we have two types of them. T lymphocytes, which are T blood cells, white blood cells, or B lymphocytes, B white blood cells. T lymphocytes against virus-infected cells and tumor cells. B lymphocytes, they produce what? Antibodies. By what? B lymphocytes. And those cells that produce B lymphocytes are called plasma cells that produce antibodies. B lymphocytes, they become plasma cells. Plasma cells produce antibodies. What are monocytes? The last type. Never let monkeys, the third in order, 3 to 8%. They are the largest leukocytes, guys. You are kidney shaped, memorize them as I said. They will use them as clues to guide you to the answer, or actually to confuse you, and you have to use them. Hello. They differentiate into macrophages. They are phagocytic. Tuberculosis is an example of using them, or where are they used, and that's it. Questions go on, you guys, we're sorry, because we don't have time. Hello. Why does leukocytosis happen? There are stimulants. مثل erythrocytosis كان في شو erythropoietin صح hormone. Here we also have few hormones. What are they? Interleukins, CSFs. Hello. Their types. Homeostatic imbalance 2. Hello. Many of the hematopoietic hormones. When we say hematopoietic hormones, we mean erythropoietin, interleukins, CSFs. يعني whatever stimulates any component of the blood. Okay, whether it's blood cells, white blood cells, platelets, whatever it is. Hello. So when we take these hematopoietic hormones like EPO, erythropoietin, CSFs, they stimulate the bone marrow of cancer patients. Cancer patients, when they take chemotherapy, it suppresses their bone marrow. So they need those hormones to stimulate the bone marrow into producing and keeping to function. Oh, yes. I'll explain it from the figure, guys. What do we say is that we're describing the formation. We describe the formation of red blood cells. We're now describing the formation of white blood cells. These are, this cell, sorry, is the cell that produces all of them, as we said, the hematopoietic stem cell. Hello? The hematopoietic stem cell is the origin of all of them. So we start with, this is your guide. It divides into two. Yani wallahi guys, you might think that this figure is confusing, large, huge, how would you memorize it? They barely will get any questions on it, but memorize it, definitely memorize it. But basically it's easy to understand, just you memorize their names. And there's no, you won't dive deep to the function, what does this one do, what does, nothing. Just memorize the line. Okay guys? We're sorry, we're short on time, and that's, for this figure, someone sent on the group that Dr. Suha said, what? Remember the number?
Lifespan.
The lifespan.
Yeah.
So the lifespan is important here, memorize for each student.
Just to add, even in the bio lab, okay, even in the final exam, they can ask you about the lifespan. Bio lab, final.
Yeah, right up one. Quick game, no?
Wallah, wala kita.
Problem. Thank you guys.
Okay, guys. Assalamu alaikum, everyone. My name is Aicha Soussi. Today I'll take over from here and speak about leukocyte disorders onwards. To begin with, leukocyte disorders, we have leukemia, leukocytosis. Does anyone know what is leukocytosis? The overproduction of?
White blood cells.
Yeah, of lymphocytes, okay? So we have the overproduction of lymphocytes, and they are, most importantly, non-functional. So we have them useless in the body, in the blood, okay? And what's the opposite of leukocytes? Yeah? Anyone? Oh, okay, it's okay. Leukemia, okay? So we have low lymphocytes in the body. Is that clear? Okay. Now we have the leukemia types. Okay, we have acute leukemia, chronic leukemia, mild leukemia, lymphocytic leukemia. Let's start with acute leukemia. Now, when I say acute leukemia, I'm talking about something that's happening at a rapid rate and quickly. So if something is happening at a rapid rate, it would make more sense for it to be in the stem cells, affecting the stem cells rather than the mature myeloblasts, okay? And this is why it affects children, okay? So the tip here is to consider the difference in ages, because this is when they play with the question, this is how to answer them. Chronic leukemia is something that happens over a long period of time. So chronic, we have the leukemia happening over a long period of time. So if it's happening over a long period of time, then it's happening at the later stages, okay? So later stages of proliferation. And it occurs mostly in elderly people. We have myeloid leukemia, involves myeloblast descendants. You guys can see this over here. Okay? These ones. So when we see the questions and we see the hint of one of these characteristics, any of them, absolutely myeloid leukemia, okay? Now what is associated with myeloid leukemia is that fever, weight loss, and bone pain. So when you look at the question and you find these symptoms, myeloid leukemia, okay? And now we have the lymphocytic leukemia. This affects lymphocytes, agranulocytes. Sorry guys. Agranulocytes, okay? And as I'm telling you that the key here is to look at the ages. Is it old, is it in adults, or is it in children, okay? Now one thing I want you guys to focus on questions, okay, on a question, is that you won't find, for example, acute leukemia in one of the answers alone. So it will not just be acute leukemia, or for example, chronic leukemia. No, I will have both of them, acute or chronic. Oh, sorry guys, acute myeloid leukemia, chronic myeloid leukemia. I will not find one of them alone. Okay, you can find, because doctors love creating questions and etc. But most probably they come together. I'm telling you if it happens at a rapid rate, and I'm telling you what type of cell it affects. Clear? Okay. Let's solve the question. Anyone? Oh, okay. So guys, see? 2. At what rate is it happening? This is first. Second, what cell is it affecting? Yeah?
Chronic lymphocytic anemia, leukemia.
Okay, that's correct. How would I give it? Sorry.
Okay.
Sorry. Can you have someone helping with this stuff? Thank you. Okay. Now, if a patient comes to you, okay, with a blood smear, and this blood smear result is out, and you're basically checking it out, okay? If we see lymphocytes is low and the red blood cells are high, sorry guys. If the lymphocytes are high and the red blood cells are low, this means what? This means leukemia. We have an overproduction of the lymphocytes and reduction of the production of the red blood cells, okay? So now, basically we have a lot of lymphocytes that are non-functional, that are just laying there, okay? So, and because we have overproduction of lymphocytes, it means that the platelets, the regular stuff that are made by the bone marrow, okay, they're not normally there in the blood. So, the normal stuff that are produced by the bone marrow are now low in number because the lymphocytes are taking over, okay? So this is why patients most suffer from internal hemorrhage, overwhelming infections, and now we have here the signs, okay? The trees. I didn't just make this out of my mind, but yeah, the trees. They're non-functional and they cannot defend the body. The treatment, you just know it. Okay, we said that non-functional, right? Non-functional. Sorry guys, we're short of time. Okay, infectious mononucleosis. Now they previously thought that this is actually a monocyte rather than lymphocytes being high in number in the blood. But whatever, that doesn't matter. So now it is a highly contagious viral disease that is seen in young adults. Okay, it is caused by the Epstein-Barr virus, and it's marked by the high excessive lymphocyte of high number of lymphocytes. Now the affected individuals, they complain about being tired, achy, chronic sore throat, and a low-grade fever. These are very important for questions. Okay, I can skip the question and I can see the signs and I can immediately answer, but don't follow that, guys. Okay. Now we have the cure. Does anyone know the cure? If there is a cure, perhaps?
No cure.
No cure.
It goes with time.
Okay, what can we do? If there is no cure, how, and will he die or what?
Rest.
No.
You
For
rest
how many weeks?
6.
4 to 6.
Perfect. Okay, you already took that. This is the cure. For you. There you go. Sorry. Sorry, I'm so sorry. I'm so sorry. So sorry. Okay. Okay, see, this is an example of a question I wrote out. He's tired and achy and has a chronic sore throat and a low-grade fever. Okay? These are the signs. Yeah. These are the signs that are mentioned under this disease. I don't need to overthink. Oh, maybe it's something else. No, khalas, simple. Just memorize. This is a memorization tip, okay? No. What is it?
No.
What answer?
B.
Okay, platelets are fragments of megakaryocytes. Does anyone know what these fragments mean? Fragments, yani?
Shards or slides.
Yeah.
Small.
Okay, yeah. So basically, it was a whole ball, let's just say, and then I took fragments of it, yani pieces, let's just say. Okay. So now this ball is called a megakaryoblast. It was immature. An immature form. What do we call an immature cell? Blast. Okay. Now immature blast, which is a megakaryoblast, okay, undergoes repeated mitotic divisions without undergoing cytokinesis. Okay. This means what? This means that the cell doesn't split. Okay, so the cell is just a huge ball growing and growing without splitting. So it's just like a large mass. Okay. Okay. So it means that the cytoplasmic mass will keep on growing and growing. Okay. And once this ball keeps on growing, let's just say that this is the bone marrow, and we have the sinusoid. A sinusoid is a type of capillary in bone marrow. Okay, it's just a type of capillary where stuff escapes from it, etc. Okay, this is the bone marrow, and this is the thing growing. It keeps on growing, until what happens, guys? What would happen? It would blast, right? It would blast, and when it blasts, these fragments come out of them. Okay, cytoplasm starts forming around them, forming like these small platelets. And this is amazing for you guys. I do it all the time. Okay, platelet release. I spoke about this. Now this is the description of platelets, right? Disc-shaped platelets, and the normal count is from 150,000 to 150,000. Platelets are always high in number in the blood. Okay, yani they are normally high. You will never find a platelet count less than this. There will be something wrong, obviously. But yeah. So platelets have serotonin, calcium, ADP, platelet-derived growth factor, they're enucleate, and they are kept inactive by nitric oxide, prostacyclin. What does nitric oxide does? What does it do?
Vasodilate.
Vasodilate. Okay. Now, if the blood vessel vasodilate, does it have a chance for the platelets to stabilize a clot? No. Okay. So meaning that what prevents platelets from sticking to the blood vessel is the release of nitric oxide and prostacyclin from the endothelial cells. Okay. Is that clear? Because I need you guys to understand this in order for you to understand the coagulation. I know it's very long. You guys are tired from the lab, and I'm also tired, but it's okay. Okay, do you guys get it? Okay. And then we have the thrombopoietin regulates the formation of platelets. It's just a hormone. When we release it, platelets are regulated. Okay. Okay, homeostasis. These are the steps I'll be speaking about. So first of all, we have vascular spasm. If there is one word I need you guys to remember about vascular spasm is constriction. We are constricting. So now I told you one thing. Nitric oxide vasodilates. صح? Okay. Platelets cannot adhere, right or not? Okay. The first step to close this one is vasoconstriction. I vasoconstricted in order to trap the platelets. Okay. I don't want them going somewhere. Okay. Does that make sense? Okay. So what is it triggered by? What is it triggered by? Vascular spasm, injury, okay, chemical release by damaged endothelial cells. This can and reflex is initiated by local pain receptors. Okay, now we have platelet aggregation. So now the blood vessel broke, right? The stuff that were released by the blood vessel is no longer being released. Okay, nitric oxide, prostacyclin, they're damaged. Okay. So this exposes the collagen that was in the blood vessel. Now the collagen is exposed. The platelets will adhere to this collagen by the VDW, right? Factor. Perfect. Okay, they will change in shape. Shape changes, increased thickness, releases mediators from the platelets. The platelets don't have this stuff just for show. No, they will use them to do their job, coagulation. Okay? ADP recruits and aggregates more platelets. And this is important, very important, okay? Serotonin and thromboxane A, vasoconstriction and aggregation, okay? And this is a positive or negative, guys? Second, positive, right? What is another type of positive feedback cycle, just for fun?
Uterine contractions.
Yeah.
During birth.
Yeah. Okay, now we have coagulation, clotting. Reinforces the platelet plug. Now coagulation, okay? Okay, now we have the platelet plug, okay? I want to stabilize this platelet. What will I use to stabilize it?
Fibers.
Fiber, okay. That's correct, okay? Forming a stable blood clot, it changes the liquid form of fibrin, which is, what's the insoluble form of fibrin? Fibrinogen, perfect, okay. To gel as a soluble protein and form fibrin threads, okay? It involves the factors I'll be talking about. They're also known as procoagulants. And now activation usually converts the enzymes into active enzymes, okay? Enzymes can be activated, correct? Okay. Fibrinogen and calcium, these are exceptions. We cannot activate them. Fibrinogen is the insoluble form of fibrin. We will convert it to the insoluble form, okay? Vitamin K is required for the clotting factors synthesis اللي هما in the liver. Okay, coagulation occurs in 3 steps. I'll be discussing them right now. Okay, now we have phase 1 formation. Now before explaining all of this, I want you guys to know the difference, okay? When I'm saying intrinsic pathway, intrinsic means inside or outside the blood vessel? Inside. Why is it inside the blood vessel?
Because the nutrients needed are inside, or the stuff needed.
Perfect, you're good. Okay, the stuff to coagulate, okay, to close this wound is in the blood. The clotting factors, the platelets, and everything is in the blood, okay? Now the extrinsic pathway, why is it called extrinsic?
From tissue outside.
Okay, خلاص, I don't have to explain. What do you think? From outside, right? Okay, what triggers it? Is there a factor or something?
Yes.
What factor is it?
Tissue factor.
Tissue factor, okay? Tissue factor will trigger this pathway. Why are we saying tissue factor in fact? No, this is not the blood. This is the tissue telling the blood that there is something wrong. I need you to coagulate and close this wound, okay? Tissue will release tissue factor, okay? It will release the tissue factor and activate the extrinsic pathway. These are the main differences between them. Now we have the similarity between them. We have the phospholipid surfaces, which is negative. We need it to be negative because the clotting factors need to stick somewhere. I'm not gonna just go with the blood, right? Okay, now calcium. We use calcium at 3 points. They're obvious, okay? Point 1, point 2, and point 3. Okay, just remember it this way, okay? Intrinsic pathway, we need the calcium, okay? And extrinsic pathway, we also need the calcium. And the part where they form the prothrombin activator, they form the calcium, okay? When you start memorizing, be like, oh, I have 3 calciums here. For example, if they ask you, does this step need calcium? Remember, where can you see calcium in the picture? Oh, I can see it here, I can see it here, I can see it here. Why? I'll explain now. Okay, now we'll start with the intrinsic pathway. Do you guys prefer if I draw, or I can just say? Okay, I'll draw. I'll draw for the people who will watch the recording. This doesn't work. I had one somewhere else. Thank you. Okay, now we're explaining the intrinsic pathway, sorry guys, okay? Now, we're going from 12 to 8 in a descending matter, but we're skipping what? We're skipping 10. Where is 10 coming? Here. When we want to do the prothrombin activation, okay? If you guys don't understand, just stop me. Please stop me, or otherwise I will not stop. Okay? So basically, so factor 12 is being activated, right? Now we have it, activation. Now, I used to be like, sorry guys. I used to be like, what is A? A is activation, okay? It's activation. I used to get like mixed by it. Now 12 will activate what? 11. Descending matter, okay? It will activate 11. Now we have it activated, okay? Now 11 will activate what? 9. Why not 10? Yeah, okay. So we're skipping 10. Just be like 12 till 8. Oh, but I'm skipping 10. Why? Yeah, no. Okay, so now we're activating 9. I hope this makes sense for you guys. Okay, and now comes what? The calcium. So this is where we need the calcium. Now we're gonna form, I don't think it's going to, okay. Okay, sorry. Okay, now we're gonna form a complex. So we said 9 gets activated. Okay, and 9 activates what?
8.
Okay, and they form what? A complex. Okay, now this complex will activate, will create the prothrombin activator. Now let me explain the extrinsic factor pathway, sorry guys, and then we'll come to the common pathway, which is the prothrombin activation and going on. Is this clear or not? Just 12 till 8. Descending matter, skipping 10. Why? It comes in the common pathway. Okay? Any questions? Okay. Oh, and also guys, this is slower. Why? Yeah. Oh, I thought you were sorry. Why is it slower? More intermediates, okay? However, the extrinsic pathway, we can really see less intermediates, less pathways, okay? I'm so bad at this, I'm sorry. Okay. This is why when there is extensive tissue injury, we always go the fastest way. Okay? Now we have the extrinsic pathway. Okay guys? Now the extrinsic pathway, we said, where is it? Guys, I just decided to draw right now, by the way. I was supposed to do the blood group, not this one. But anyway. Now the tissue factor, okay? Tissue factor, which is what number, by the way?
3.
You're ready for the exam, خلاص. Okay, tissue factor 3. Along with activates factor
7.
7. Okay, now it gets activated. Okay, one second. Sorry. Let's just do it this way. Activates factor 7 using
Guys.
calcium. So this is the second time we're using calcium here. Okay, it gets activated. And factor 7 goes where? Where does it go? It goes and activates factor 9. This is why we call this less intermediate and faster, okay? Instead of just going all of it together, I can simply أختصر الموضوع and just cut in half. Cut in half, activate factor 9 immediately, and just go with it, okay? Now it forms a complex, and we're going to the common pathway. Does anyone have any questions? So it is faster, bypasses several intrinsic steps. It's the tissue factor activates factor 7. Factor 7 gets activated along with calcium, okay? And we're activating factor 9. Factor 9, okay? Factor 9 is being activated, which goes on to the common pathway. It's skipping 2 factors activation, okay?
I have a question.
Yeah.
No, factor 7 kind of jumps from the extrinsic to the intrinsic pathway, but our doctor says, regardless, they don't count it as a common factor.
A common factor?
It's not a common factor, because I didn't understand why, if it's involved.
This is not a common factor. This is like, this is a pathway. Okay, this is pathway 1. And this is pathway 2. Into you mean, since it's cutting through here, so it is common in both? Is this like a misconception? You don't get it, huh?
Yeah.
Or is it something I said by mistake?
No.
Okay. I get you, sorry. Okay, so basically, where's the pencil? Okay, factor 7 gets activated. Tamam? It cuts through. This is the idea of extrinsic pathway. And I'm not injuring the blood itself. Okay, I'm injuring the blood vessel itself. I'm injuring the tissue. But if I'm injuring the tissue, I need it to act fast. I cannot wait for these 2 steps to happen and the enzymes to get activated and this and this, okay? I need something that cuts through and skips these 2 steps and just act على طول. You get me? So factor 7 is the only factor that is able to cut through. And I could have used, for example, factor 5. I will be using it here anyway, not here. This is the factor شغلانته هون basically. What it does is here. This is how it works.
Can one pathway be used alone, or do they always come together?
No, this is why they happen simultaneously. For example, if you have tissue injury, this is happening first, and then this is happening first, as we can see. Do you get it? Or should I re-explain it? Okay, I'll explain actually. We have a tissue injury. If the tissue is injured, it will release tissue factor. Tissue factor will alert the body and tell him, help me, I need help, I need something to act fast. I cannot wait, okay? This, by theory, it takes time.
Yeah.
Time consuming. Oh, 1 second, guys. This is time consuming. Time consuming. I need something that cuts these 2 unnecessary steps, okay? And act fast. I need something to activate factor 9 in order for me to go here fastly, okay? And the only factor that does this is what factor? 7. And I cannot say, for example, factor 5. Factor 5 is here. Factor 10 is also here. Each factor has a role, okay? Factor 7, its role is to cut through تقطع طريق, or let's just say, okay, stop, and I'll just activate factor 9 instead of you going too slow. Okay? Does that make sense? So لما يكون عندي tissue injury, I'm not gonna have this working alone. Okay? لما يكون عندي tissue injury, I'm not gonna have it working alone. That's what also confuses.
If factor 7 is skipping the first 2 steps, when are the first 2 steps used? If it's always skipping them?
When it's a normal blood injury, a blood vessel injury.
Okay. When it's a normal blood vessel injury, intrinsic.
Yeah.
And then when it's what? It will be extrinsic.
When the tissue is damaged.
Okay.
Okay, when the tissue is damaged, extrinsic. When the blood vessel is damaged, intrinsic. لخبط بينهم. I said intrinsic for this, right? And extrinsic.
I know.
Okay. Okay. Now we come for the common pathway. Okay, before the common pathway, guys, let me explain what happens here, because I realized I didn't put it in the other slide. So now the complex has formed. Okay, the complex has formed. It activates factor 10. 10 gets activated. شوفي, I told you, for example, factor 10, its role not to cut but to form the prothrombin activator. Each factor has a role, okay? And the roles comes according to where they are. يعني I told you 12 to 8 descending, but skip 10. لأنه 10 مو يعني it's not its role to be within them. Its role is to form the prothrombin activator. Activation. Is that clear? Okay. Now, so we have now the activation of factor 10. Along with calcium, this is the third time we see calcium. Third time we see calcium with factor 10 activation, which will activate factor 5. So factor 10 activates factor 5. Factor 5 activated. Factor 10 activated calcium and phospholipid surface, because we need a negative surface, will form the prothrombin activator. Is that clear? So what forms the prothrombin activator? Anyone else want to answer? Go ahead, just read.
Factor 10, calcium, phospholipids, and factor 5.
Oh, activated factor 5. Activation, okay? حتى هون it's written prothrombin activator consists of factor 10 activation, activated factor 10, activated factor 5, and calcium, and the phospholipid surface. Okay? Now we have the common pathway for the prothrombin, for the conversion of prothrombin into thrombin by the prothrombin activator. It will convert prothrombin into thrombin. When thrombin is activated, خلاص, game over. The anticoagulants that I'm going to be talking about, they mainly target who? They mainly target the thrombin. Okay. Now, thrombin is activated. Thrombin will activate, it will convert the fibrinogen, the soluble form, into the insoluble form. And it will also activate. So, thrombin has two activations. This is why I'm saying when it's activated, خلاص, game over. Okay? So it activates, sorry guys, it converts fibrinogen into insoluble fibrin, and it activates factor 13. What's the role of factor 13? Yeah, stabilizing the clot, right? And forming, where is it? Cross-linking, okay? Cross-linking between them, using calcium. So this is the fourth time we see calcium here, okay? 3 times in the 2 pathways and the common pathway. So 1 time here, 1 time here, 1 time here. And the 4th one is here, okay? Cross stabilization, which is done by factor 13. Now, thrombin plus calcium activates factor 13, as I said. Now, factor 13 is activated, it cross links and forms the bonds, and results in a strong stable. Now, role of anticoagulants. Anticoagulants. Prevent clotting. Okay, what time is it?
5:23.
Okay, well, let's move faster. Clot stabilization and removal. So we're basically stabilizing the clot, okay? Now the clot has formed, okay? After if it's fine to stay on its own, I need to remove it. Now these steps are for removing it. We have clot retraction, the blood clot, it shrinks by actin and myosin. This is important. The serum is squeezed out. This is important. And compact and stabilize the clot. Okay. Now we have the vessel repair, okay? The platelets, they have what? They have the platelet-derived growth factor. I need to fix 2 things that I damaged, okay? The smooth muscle and the fibroblasts and the endothelial cell proliferation. So I will release 2 things. PDGF for the smooth muscle and fibroblasts, and VEGF for the endothelial cell proliferation, okay? Now one thing, actin and myosin, they're from what? Smooth muscles, okay? So this factor will cause them to contract and etc. Do you guys get it? Okay. Now if it's stable and if it's okay on staying on its own without needing the fibrin, now I need to remove the fibrin, the soluble form. Does anyone know how? We need something to break it, right? Okay. This is by plasminogen. Plasminogen is the active form of plasmin. which is activated by tissue plasminogen activator. This is released from the cells. Factor 12 and thrombin. Okay? See, even thrombin is here. This is why it has a huge role. Factor 17 behind, you guys can read this. Now, what blocks the conversion of fibrinogen into fibrin? We have the fibrin. The fibrin itself can bind to the thrombin to prevent further activation, okay? Because the thrombin amplifies coagulation by activating factor 5. Factor 5 will do what? Factor 5? Factor 5?
Activate prothrombin.
Yes. Factor 5, which enhances prothrombin activator, okay? Activating platelets, accelerating the intrinsic pathway. Now we bind thrombin, okay? This is why thrombin acts as an anticoagulant, okay? Because it binds to thrombin. Limiting clot size and antithrombin 3. Do you guys know who enhances antithrombin 3? Who enhances it? Enhances the activation of it. Antithrombin 3.
Heparin.
Oh, heparin. Sorry, I didn't know. Sorry. Yeah, heparin. Okay, it's here. Now we have the protein C. It inhibits key clotting factors in the intrinsic pathway, and heparin, which it enhances antithrombin 3 activity, which is a natural anticoagulant in the blood. It inactivates factor 2, the thrombin. Okay, and other clotting factors which are used in what pathway? Intrinsic. Okay. Okay, now we have this table. I need you guys to focus on what do we use? What clotting factor uses vitamin K to be synthesized? A simple mnemonic, 1972. Sorry. Okay, it's basically here. Okay? 1972. 10, 9, 7, 2. Okay? And basically by the end of the chapter, you will find awesome that you know most of them. Because for example, anticoagulation, we spoke about fibrinogen, prothrombin, tissue factor, calcium. Yeah, okay? Anyone knows? Fast, 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 fast. 3, 2. Last one.
D.
Okay. And here, just a hint for solving this question. Okay. You guys know what's thromboplastin? What is thromboplastin? Thromboplastin is also called tissue factor, which is factor 3, which is in the extrinsic pathway. Okay. You guys want to solve it? A? You're saying A? No. Just which one of them?
B.
Switch the yeah. B. Formation of thromboplastin, which is a tissue factor. It will activate the extrinsic pathway. Okay. After the activation of the extrinsic pathway, we have the prothrombin into thrombin. After prothrombin into thrombin, we have the fibrinogen into fibrin. And then we have the clot retraction of getting rid of the fibrin, okay? Now disorders of homeostasis. Thrombolytic disorders. Thrombus is basically when there is a clot in the blood. Now if this clot moves, then this is called embolus, okay? If this embolus stabilizes and sticks somewhere, then it is called embolism, okay? We have examples and risk factors. Atherosclerosis, it hardens the blood vessel, it causes the fat deposition, okay? I added this slide just for the sake of me. Okay, now we have aspirin, okay? Aspirin inhibits thromboxane A2, which is released by platelets. So we have less platelet aggregation. Okay, so thromboxane A2, what's the role of it? Platelet aggregation. Aspirin blocks that. Now, anticoagulants, I don't want the blood to clot. If someone is suffering from coagulation and for example atherosclerosis or etc., I will give them these for them to inhibit the clotting. Okay. Heparin, it prevents the venous thrombosis. Now venous thrombosis is basically the formation of a blood clot within a vein. Okay. Now warfarin and direct oral anticoagulants. Warfarin inhibits vitamin K dependent clotting factors. Vitamin K dependent anti-clotting factors are the ones we mentioned, 1972. Okay, so they block them. They block their formation. If I don't have these clotting factors, my blood, my tissue cannot clot. Okay? Now, who synthesizes the clotting factors? We said the liver, correct? Now, direct oral anticoagulants, it's just an alternative mechanism instead of warfarin. And this is a key. Stroke risk in atrial fibrillation, venous thrombosis, hospital. These, they might throw it in the question, and you would be like, oh, it's not important. But if you memorize the book, then you would know it's there. Okay? See? Atrial fibrillation. Then what is it? What is it?
Warfarin.
Yes. You get another one? Reading disorders. Thrombocytopenia. Okay. Now, so we have low platelets. Common causes: platelet deficiency. So, a platelet deficiency, thrombocytopenia. Clotting factors deficiency due to liver dysfunction. Genetic disorders. Liver dysfunction. I don't have vitamin K. I cannot synthesize the clotting factors, and therefore I have bleeding because I cannot clot. Platelet count less than 150,000. Okay. Severe cases, spontaneous bleeding, causes bone marrow suppression, destruction. Now the causes bone marrow suppression by whom? By leukemia, for example. If I have high count of lymphocytes in the blood, then I have low count of platelets. So my blood cannot clot anymore. So they will die from internal hemorrhage. Okay. Now this is an important clinical sign. Small purplish skin spots. Keyword.
Small bar.
مفروض يلا. ايه. Find it. Impaired liver function, okay? Now we have impaired liver function. So as I said, we're just repeating it, okay? Liver dysfunction, the clotting factors are no longer working, vitamin A or vitamin K synthesis inhibition, which will lead to low clotting factors in the blood, okay? Okay. Now hemophilia, we have A, B, C. They're easy, just remember A, B, C, okay? They're also easy to remember, why? 8, 9, 11. We're also skipping 10 here, okay? 8, 9, 11. So we're skipping 10 two times. One in hemophilia and one in the coagulation steps, okay? 8, 9, 11. Now A and B that comes after each other are X-linked. So if they're X-linked, they will affect males, okay? Common complication is for them to bleed into joints. This is like, whatever I put in bold, it's just key hint, okay? Questions and etc. So they are managed by transfusion of fresh plasma or injection of the missing clotting factor. Because these are factors, okay? These are clotting factors that are missed in each cases. A, B, C, 8, 9, skip 11, skip 10, sorry, 11. Got it?
Why is C less severe? The book explained to the doctor as well, so I didn't understand.
Why is it less severe?
C, yeah.
هلا صراحة I don't know. But maybe because since if it's not
Something along the lines of 11, I think can be made up by another factor, so I didn't understand that.
yeah, it can be made up by another factor. That's right.
That's it.
By who do you remember?
7.
Factor 7.
7.
Yeah. Oh yeah. Okay. Okay, that's a really smart question. Look. So for example, if we don't have factor 11, factor 7 can compensate for that because factor 7 bypasses. So now I don't need factor 11.
Wait, where was 11?
This one.
Oh, okay.
Okay. So if C is less severe, why? Because factor 7 can cross, and basically I no longer need factor 11. You got it?
But 8 and 9 are above.
8 and 9 تحت. I mean 9, 8.
Oh, it's nothing makes up for them.
Nothing makes up for them. Okay, this is why C is less severe. That's very good. Okay. Yeah. A. What number did we start with? Yeah. Okay. DIC. Now the key idea here is that I'm using all of my clotting factors, all of my warriors, let's just say, to unnecessary clot. Okay. So if I'm overusing the stuff I have, when I actually have an emergency, I have nothing to clot. I have nothing to use to clot the blood. Does that make sense? So if, for example, this is just an example, I have platelets, tamam? And these platelets are unnecessary clotting something that doesn't need to be clotted. For example, there is no injury أصلاً من الأساس, but they're just clotting it. It's a disease, okay? They're just clotting it. If I use all of my platelets, and let's say the next day I have an injury to the blood vessel, who am I gonna call? They're gone, okay? But these are to do with clotting and clotting factors and etc. So widespread clotting and severe bleeding, complication of pregnancy and the result of septicemia, and incompatible blood transfusion. Now one key here, if the question doesn't mention these, don't think it's not DIC, okay? So if the question doesn't mention pregnancy, septicemia, don't be like, oh, this can't be DIC, because we fell into this trap. But yeah, it can be a key, and maybe the idea of DIC is here. I'm using all of my clotting factors, all of what I have, all of my warriors, and when there is a serious injury, there's nothing to use. None. No. بسرعة. Why are you answering everything? Aman, answer. Okay, transfusion. So now when we have severe blood loss, risk of shock, you guys can use this. Blood volume loss, isotonic solution, replaced with crystallized solution. These are preferred one limitation, and nothing can overtake the job of RBCs, because RBCs, they have the carrying capacity of oxygen. So we need, if you want something to carry the oxygen, to replace the carrying capacity of oxygen, it would be RBC only. Okay, so blood transfusion, we have whole blood. Whole blood contains RBCs, plasma platelets, proteins, and electrolytes. Only in like severe cases, and we have the RBCs, which can do the job of oxygen carrying capacity. Human blood groups, antigens, transfusion of incompatible blood result in agglutination and RBC destruction. We have not two type, ABO, so basically if it's A, B, O, or AB, and we have the RH, so basically if it's positive or negative. Okay, now group A, I'll draw on the board. Is it clear? Is it clear on the board? Okay. So okay. So now group A, okay? A. Now A has the antigen A, okay? Has the antigen A. What are antigens? Antigens are basically proteins that are on the RBC that signals I'm A. It just has a structure of antigen A, okay? So this is antigen A. Now group B, okay, I'll be cool guys, has an antigen of B. Okay? Group O has what antigen?
No.
Correct. Group AB?
Both.
Correct. Guys, rate my drawing. Okay, we're almost there. Sorry guys. Okay, this is for the main part. Now, we're talking, now we're done with the antigens, okay? Antigens is what is on the RBC. Antigens are proteins. The structure of the protein either resembles A, B, or nothing, or both of them, okay? So now when we talk about the antibody, we need something that protects this RBC from other blood types. Oh, my blood type is A. I don't want B here, okay? Or my blood type is B. I don't want A here. I don't want A here. A doesn't suit me. It doesn't have the same structure, and I will attack it because our body usually does what? Our body usually attacks foreigners. Okay? So if I see something entering my body and I do not recognize it, I will attack it. Perfect? Perfect. Okay. Now coming to the antibody. So if I'm group A, what will I not want to see? What will be my foreigner?
B.
B. So I will have antibody
B.
B. And if I'm group B,
A.
and if I'm group O,
All of them, both.
both. I wouldn't want to see group A or B because I have nothing on my surface. Why would I want to see them? They want I will not recognize them as self. I would recognize them as foreigner. And anything as a foreigner, we will attack. Okay, that's the role of the body. In anything, transplantation, blood transfusion, infection, inflammation. Okay? Group AB?
None.
None. Okay, now this is like this, no? Okay, this is about plus and negative. I'll be explaining it now. I just want you guys to know that the immune response for plus and negative, or should I explain it after? Okay, it's okay. So basically, if I have a transfusion problem, in case of plus and negative, A plus or A negative, I will synthesize the first time, and upon re-exposure, I will attack. So let's say this foreigner entered my body. The first time it entered, okay, you're welcome. Khalas, okay. I can accept you this time, but next time you enter, I will attack you. Okay? So we give them a chance. Oh my god. We give them a chance the first time. Okay? The second time, I will attack you. This time you're welcome, next time you're attacked. Okay? So upon I will sheet the first stage is sensitization, sensitivity. And then upon re-exposure, we're going to attack, as I said. Okay, I'll explain it now. Okay. Now guys focus, okay? If I'm group A, okay, if I want to donate blood. Okay, now we're talking about donation. Transfusion reactions happen upon donation. Okay? Transfusion, we're transfusing blood. Okay? So if we're group A, I would want to give to my sister. Okay? To my sister. Not sister in my actual sister. La, sister in like me. Someone, my best friend. So I would love to give A. Okay? Is that okay? So I don't want to give B. B is not like me. He doesn't have the same shape as me. Why would I give him my blood? Okay? So I would want to give who? A. And I would also want to receive from who? From A as well. Okay? Let's just start simply. I would also want to receive from A. Okay, I gave my sister, but بالنهاية we're sharing. So I give you and you give me. That's rule. Okay? So A. Now, I can also give someone else, but we'll speak about this later. So let's follow the same thing here. So I would want to give who?
B.
B. And receive also from who?
B.
Okay? B. I would want to give
O.
O. And I would want to receive from? I would want to give
AB.
AB. And I would want to receive from?
AB.
AB. Now the next step, okay, to figure as well who else can I give is to think about the mechanism, to think about the antibody. Who would my antibody attack and who would my antibody wouldn't attack? If there is something, if there is a blood group my antibody wouldn't attack, we would definitely go with that. For example, if A, okay, if the sister liked someone else, okay, liked her cousin, for example, she would give her. But if she doesn't like her, she will attack her by her antibody. Does that make sense? Are we good on that? Okay. So who do you guys think I can also give? So I can give A. Who else would I give that won't attack?
AB.
Yes. You guys get why? لأنه A doesn't have any antibody. If it doesn't have any antibody, if I give it A, it will not attack me. Clear? Something that doesn't have an antibody to the thing, to the RBC I am transfusing, can take it. Why not? If that thing has an antibody to the thing I'm transfusing, no, it can't take it. Okay? A. So it can also receive from A, and who is our universal donor?
Oh.
O. Who is selfish? Yeah. Why is it selfish?
Didn't give anyone.
Huh? Yeah. It takes from everyone, but only gives himself. Selfish. Okay? It takes from everyone, but only gives himself. خلاص, end of story. خلصنا مع AB. We're done. It has no antibody. It has both antigens A and B, and because it has no antibody, I can take from A and B my no antibodies to attack it. Math. And anyway, blood group O has no antigen. Okay? And it will only receive from AB. Why? Because it's selfish. Okay? Now let's come back to A. So it will give A and AB. Who else will it receive from? We said that the universal donor is O. احنا already حطينا O عند AB. What's left?
O.
A and B. Okay? Similarly to A, since A can give AB because AB has no antibody to A, it can also give to B. Why? Because it has no antibody to B. Perfect. Is this clear? Okay. Now, because we said that O is the universal donor, it will give everyone. Okay? بالعربي بنحكي O كريم و AB بخيل. Okay? Okay, A, B, and AB. Guys, are you following? Anyway, you can watch the recording and go all over this again, because when I was in your shoes, I wanted someone to explain it this simple to me. And unfortunately, I only got it after the exam. Okay, now we have the major problem. What is it? RH. Okay, now we need another word for this.
Do you want this one, Aisha?
الريكورد.
لا بدي اياهم كلهم مع بعض بس عم بفكر انه how can I. Okay, that's okay. I'll erase this.
Erase it?
Yeah, no worries. I'll erase it. شو صار؟ Okay, I'll just remove these circles. Guys, don't worry, after this we're done. We just have the blood test and we're done. Okay? Now we have A positive and A negative. Is anyone here A positive? A negative? مستحيل. I mean, there is this. Yeah. Okay, B positive. I'm B positive. B negative. No, صح? I won't even look. O positive.
Oh.
O negative. Wallah, if you're O negative. O negative?
No, positive.
O negative?
والله You think? طب احنا we did it last year.
Guys, O negative is crazy. You can give to anyone.
والله negative.
Okay.
AB positive.
لا AB بحس AB is only in animals. صح؟ Guys, I feel like AB is only in animals. ولا شو رأيكم؟ AB is only in animals, no? لا بس يعني أنا قصدي مبالغ في AB in animals. خلاص.
It exists. عشان.
Oh. Okay. Now the rule says what? Okay? Positive can only donate to positive. Negative can donate to both positive and negative. Why? How? Just memorize, okay? So, يعني the same thing we wrote here, I will copy paste it in science. Okay, I will copy paste it in science. So basically, A positive will give all positives, and negative will give both. Okay, guys, just for faster time, يلا help me, just نقلوني. يلا B positive will give. Oh, okay. B positive, negative, and B positive, negative. So O will give. This is give, okay? It will give O positive. Okay, wait, I can do this. A, B positive. And O will give. Yeah, it will give O, A, B, AB, negative. Okay? Negative and positive. And plus will give. I'm just copying really what I'm doing here with the rule. And no plus gives everyone. I mean, plus gives only plus. And negative gives both. Okay, is that clear? Okay. Now we have, if it gives, it also receives. Okay, because we are short on time, I just wrote it here, okay? So basically, O negative donates to everyone, because it's negative, I'll give everyone. أصلاً O is a universal donor, صح ولا لا؟ صح. And because it's negative, it will give everyone. Because it's negative. Negative gives to negative and positive. And it will only receive from negative. Okay? Why will it not receive from positive? Because positive has the antigen D. Okay, antigen D. And negative doesn't have this antigen. So once, this is what I talk about here. Okay? Once it looks at it, it will not do anything. The first time you're welcomed. The second time, I will attack you. Clear? This is why it cannot take positive. Negative cannot take positive. Because it will attack it. Okay, and the student can look over it. Game time, there is no time to play I did the cards. Okay, transfusion reaction, I also spoke about this. So basically, if I give the wrong blood, anticoagulation will happen. Agglutination, sorry. Agglutination is when the antibody sticks to the antigen. This reaction, we call it agglutination. Hemolysis, the rupture, and then the hemoglobin in the blood. And then I think Mohib spoke about what happens to hemoglobin, etc. Consequences: low oxygen transport, blood flow low. Now we have the kidney damaged. Why? Because of the process of elimination. Okay?
The process of?
Elimination.
No, wait, elimination of what?
Elimination, for example, of hemoglobin.
Because
Yeah,
they're attacking
from
something.
hemoglobin. No? From hemoglobin. Now we have a lot of hemoglobin. It's going to the kidney. But now, it's overwhelming pain. You guys see? Okay. Now, homeostatic imbalance اللي هو about pregnancy. Now the rule says, okay, the rule says one thing. If the woman is negative and she's pregnant for the first time, okay, for the first time, with a positive baby, she will welcome him and tell him, okay, you can stay. But what did we say the rule about negative and positive? Negative will only welcome positive one time. The second time, I will attack you. Clear? So if the mother is pregnant the first time with a positive baby, she will welcome him, deliver safely, and etc. Okay? During this time, she will synthesize, she will form the antibody against the D antigen. The D antigen has to do with the positive and negative. Positive has the D antigen, negative no D antigen, and etc. Clear? Okay. So it will synthesize, it will create the antibody against it, and the next time it will attack the next baby. How do we prevent this? Rogam. Okay? Rogam is given during pregnancy. Okay, during pregnancy, and during pregnancy of the second baby, and after the delivery of the first baby. If she found out that the baby was actually positive and she was negative, if she knew about it, sometimes they don't know about it. Okay. Okay, now the cross matching, I think you guys did this in the lab. So basically you take your, do I need to explain this? You take your blood, anti-serum, you put the anti-serum on your blood and you see if it coagulates or not. Did you do it? I think today you did it, stop. Okay, blood appears like chemistry, so if you have low hematocrit anemia, lipidemia, blood glucose diabetes control, white blood cells leukocytosis infection, eosinophils is associated with parasitic infection, now prothrombin time, like the time prothrombin takes to be activated, platelet count, thrombocytopenia, if it's low, complete blood count will show formed animal hematocrits and hemoglobin, electrolytes, glucose, liver, and kidney function. Okay, that's it, guys. Thank you.